Okay, welcome to the part 3, the ankle and foot. We'll start off with the subject assessment first. With the current history, you have to establish the kind of disorder that the patient's coming in to see you about, and then determine the areas involved in the subject symptoms. So, things you need to be thinking about with the ankle, when they describe pain or discomfort and or stiffness, work out whether it's an acute injury, and you've got to determine the actual area of the body, obviously. Other things to question them about, they may come in and say, oh, I've got a sore ankle. However, you have to go further than that and ask them whether they have any giving way or instability, and that may lead you to working out whether they've had inversion injuries, things like that, or a current lateral instability, and the length of the history of the problem. Is it acute? Is it a recurrent problem? Have they been rolling their ankle many times? Is it a very chronic thing going on for years? And how many times they've done it. Other things to ask are clicking and impingement, whereabouts they get it on the ankle, whereabouts the clicking is. Is it a ligament clicking? Is it a tendon clicking? Is the impingement in the front and the back? And whether the actual clicking or the impingement is actually painful or not painful. Sometimes they complain of weakness, where they're unable to hop or unable to run, and also weakness left and right. And as well as loss of function. So how rapidly or gradual did that loss of function develop? Is it very instant? Is it over a long period of time? You're also looking, you're also asking whether they've got any swelling or tenderness, and how long they've had that swelling tenderness for, obviously the area. As well as pins and needles, always asking about paresthesia and anesthesia, pins and needles and numbness, whether that is constantly there, which may lead you to think that there's some compression going on, or whether it's intermittent, and of course where the areas depending on the dermatomes or actual localized areas for swelling, things like that. Record all these on your body chart, asterisk all the ones that are important, and also record all the related sites of pain. There may be pain in the ankle, but is there other pain up the leg as well, including the lumbar spine, and also thinking about your trigger point referral. So, once you've established what type of problem they come in for, then you need to think about the mechanism of injury. Okay, so when you have an onset of pain or symptoms in the ankle that is very sudden or very immediate, I should say, obviously it's acute injury, or other things. So the acute injury, they will tell you whether it's acute injury or not. They may have sprained the joint, they may have sprained the ligaments and the soft tissues. Other things that they have, if it's insidious onset, very acute, it could be something like pseudic atrophy, which you've got to be very aware of.